Thank you very much, Mr. Chairman and Madam Secretary. I want to echo the remarks that Mr. Waxman made. I think you're doing a fine job as Secretary, and I want to thank you, my constituents, for the job and the good work that you do. I am very proud of the fact that my state of New York trains the largest number of medical residents in this country. We have over 15,000 residents developing all kinds of life-saving skills in our state as of 2010, and we train, New York also trains the largest number of primary care physicians in the country. Given the increasing age of our baby boomer generation and 32 million newly insured Americans projected to enter into our healthcare system in the next few years, I'm concerned about the significant physician shortage that this country is facing. So I want to echo the statements that Mr. Pallone made earlier. I was disappointed to see that the President's budget included a 10% cut to indirect medical education funding and a $177 million cut to children's hospital graduate medical education funding. I think we need to be training more physicians and adequately supporting our teaching hospitals, not cutting their funding as they strive to train more providers. Hospitals will already see significant cuts to bad debt and dish payments, which disturb me greatly because we fought for dish payments for New York in the Affordable Care Act. So as a result of H.R. 3630, the Middle Class Tax Relief and Job Creation Act, bad debt cut and dish payment cuts are there. So I would just ask that the administration reconsider additional cuts, especially when it comes to training our physicians.
Well, again, I share your feeling that a critical piece of this puzzle for the United States having better health care, better patient care, better health is certainly a robust workforce focused on prevention. And so we would work with you to make sure that we're using all of the assets, all of the resources to do just that.
Well, on prevention, one of the best parts of the Affordable Health Care Act, I think, was the establishment of the Prevention and Public Health Fund. I think that should be a priority. And I was also disappointed to see that significant reductions were made to various HHS agencies, including the CDC, as part of the budget request. The rationale which we read, it was provided, was that the preventive fund would help fund these programs, the prevention fund would help fund these programs facing cuts, but the point of the prevention fund was to add to the budgets of various public health programs, not to just supplant their existing funding. So given the FY 2013 budget request, and in light of the fact that the Middle Class Tax Relief and Job Creation Act cut over $5 billion from the prevention fund, I'm concerned that we won't be able to fulfill the goals of the prevention fund. So could you please explain how the various programs facing cuts, especially those at the CDC, will be impacted given the payroll tax extension legislation, which is now law?
Well, I think that we are eager to not only have the basic programs of the Centers for Disease Control and Prevention continue on. They're vital. They're vital to states around the country. They're vital to the health of all Americans. And some of the prevention funding, you are correct, is paying for those ongoing programs. I would say that also there are some innovative and new programs that are showing great promise that also are part of that prevention funding, and we are going to, now that we have an outline for the further reduction of $250 million, be working closely with Congress to make sure that these initiatives don't take even more disabling cuts. Unfortunately, at the state level, as you know, Congressman, the states have made some serious reductions in their public health budgets. So we are really trying to not only make sure that the national efforts go forward, but that the state workers who are embedded in state departments across this country doing vital public health work are also continued.
I want to quickly mention dental care. In a report, the Pew Center report, says that preventable dental conditions were the main cause for over 830,000 emergency room visits in 2009, which is a 16% increase from 2006. And in New York, we estimate $32 million was spent treating children for dental-related ailments in emergency rooms. in 2008 alone. I introduced H.R. 1606, the Special Care Dentistry Act, which would require Medicaid programs to provide dental services to age-disabled and blind beneficiaries. And I'm just wondering, is HHS working to address the shortage of dentists in both our urban and rural areas, and how can we encourage more dentists to serve children and vulnerable adults on Medicaid?
Well, Congressman, we would be really eager to work with you on this. It is an enormously challenging problem. I think more so than virtually any other provider group. We see a great shortage of dentists who are willing to participate in the Medicaid program. We're working actively with states and others to figure out strategies to engage more dentists, but I would say that we would love to have your strategies, your ideas, because it is a challenge in virtually every part of the country, rural and urban, where we see this lack of providers who actually deliver incredibly important health services.
Thank you, Madam Secretary. I'll be in touch with your office on
Thank
this
you.
and another bill that I've introduced about Moms and Babies Act. Thank you.